need to know all these bacterial infections because they have very important oral manifestations, and as dentists and as members of the health community, it is our responsibility to identify these and refer our patient to a general physician so that proper treatment is received, and hopefully at the earliest. The first bacterial infection we are going to read today is caused by group A beta hemolytic streptococci, and the infection is called as scarlet fever or Scarlatina. I hope you all know the meaning of the word scarlet. Scarlet is basically red, the color red, because you will understand that the clinical manifestation, one of the main clinical manifestation of this infection is related to that color. We'll see what that is. So this group A beta hemolytic streptococci elaborates an erythrogenic toxin. Erythrogenic toxin, erythro, the word basically relates to the blood vessel, so understand that this kind of toxin attacks the blood vessel, and that's what causes a characteristic skin rash which we see in this infection, and that is the reason why it is called scarlet fever. Can you see the red rashes all over the body? Very unique for this disease. It is highly contagious and it is spread by sneezing, coughing or direct contact, and incubation period is between 1 to 7 days. Sore throat and exanthema are very important clinical features. Exanthema basically means, it's derived from the word Greek anthe, which means blossom. So basically exanthema means eruptions all over the body. As you can see, there will be skin eruptions along with the sore throat, which are the important clinical features of Scarlatina. Fever starts around second day, and by day 6 the temperature returns back to normal. Usually it affects the children between the age group of 3 to 12 years, and there is scattered petechiae. What is the meaning of petechiae? These are pinpoint bleeding spots, correct? On the soft palate are seen. Enanthema of the oral mucosa, which usually affects the tongue and the soft palate, and that could result in what is called as a white strawberry tongue, as you can see in this image. So there is a white coating on the dorsal of the tongue, that is on the dorsum surface of the tongue, but only the fungiform papillae can be seen. Can you see these red dots within the white patch? Yeah, so that is called as a white strawberry tongue, and the other is called as a red strawberry tongue. So the white coating, this white coating eventually desquamates. So that reveals a very reddish, that is the erythematous surface with hypoplastic papillae. So the skin rash, which is the characteristic feature of this infection, spreads within 24 hours and usually affects the trunk and the extremities. Extremities are your hands and legs, okay children? And this usually looks like there is a sunburn with goose pimples. That's how you can describe it in layman terms. So what are these goose pimples? Basically pinhead punctate areas which are normal in color project through the reddish area. So this is what gives it a goose pimple description, and the whole texture looks like a sandpaper because of this. And these rashes are more in case of pressure areas, that is where you're sitting, yeah, that is one of the pressure areas, and the skin folds because your hands and legs fold, correct? So there is always a skin fold. In these areas the rashes are more, and they appear as transverse streaks along these folds. So these are called as pestious lines. And the rashes will clear within 1 week to 8 weeks. Because of the advent in the modern medicine, antibiotic with either oral or injectable penicillin, that is IV penicillin, can cure this disease. The next infection we are going to discuss is tuberculosis. So it is an infection, of course. Along with that, it is a granulomatous disease. We have studied about the granulomas, right? And the granulomatous infection and how inflammation can result in a granuloma. So this is a granulomatous disease, and it is caused by an acid-fast bacilli called as Mycobacterium tuberculi. So why this infection is dangerous? Because it is spread through airborne droplets from a patient who has the disease in an active condition. So there are two stages or two types, primary tuberculosis and secondary tuberculosis. Primary tuberculosis mainly involves the lungs, and this begins as a fibrocalcified nodule at the initial site of involvement, that is the lung. Organism in these nodules will remain dormant, that is inactive, for years. In secondary tuberculosis, basically it progresses from infection to active disease in a compromised host. Whenever the immunity is compromised, for example, the dormant infection becomes an active disease. Coming to the clinical features, in miliary tuberculosis, the meaning of miliary tuberculosis is whenever there is a diffuse dissemination through the vascular system, that is your blood, and many organs are involved like kidney and liver. So the main symptoms, this is common for tuberculosis, it is a very specific symptom: fever, chills, malaise, weight loss and night sweats. Weight loss, very important symptom, sudden weight loss, that is. Cough, hemoptysis. I have described you what is hemoptysis in the previous classes. It is coughing of blood, yes, cough, coughing of blood, and chest pain is another very important symptom. So whenever if the patient comes and tells you that he is having chronic cough and sometimes with blood, and there seems to be a sudden weight loss and there is a fever, your first differential diagnosis should be tuberculosis. And another problem with all this bacterial infection is whenever the bone is involved, when it spreads to the bone, it causes osteomyelitis, and usually we give a prefix of whatever is causing it. So in this case it is called as tuberculous osteomyelitis. So oral lesions follow whenever the bacteria is coughed. The sputum comes and reaches the oral cavity. It reaches either the crevices, there is an open wound, there is a recent extraction site, the bacteria lodges itself there, and that's how it reaches the oral lesion. This is the path it follows. Any mucosal area can be involved, of course, but tongue and palate are involved more commonly. And the characteristic ulcer is irregular, indurated, meaning very hard, non-healing. Usually the healing period for any ulcer is 2 weeks or 14 days. If it does not heal beyond that, then you have to go and get it checked from the doctor. And if the patient has come to you saying that from 2 weeks the ulcer has not healed, then you will have to send it for a biopsy. So if there is a periapical infection and if it spreads through the bloodstream, and if there is an extraction socket already, and if the tuberculi has lodged itself in that area, then it results in a granuloma in the periapical area, and that is called as tuberculous granuloma or tuberculoma. Another important feature, which again as dentists we must know, is called as scrofula, where there is involvement of the cervical as well as the oropharyngeal lymph nodes. So you can see in the picture how the cervical lymph nodes and the oropharyngeal lymph nodes are involved, and even submandibular lymph nodes are involved in this scenario. And these enlarged nodes can develop caseous necrosis. I hope you all remember from general pathology the meaning of caseation necrosis. And if you remember, we had discussed tuberculosis under caseation necrosis in general pathology, correct? And this caseation necrosis will progress to form an abscess and eventually forms a fistula through the overlying skin. And if you take a radiograph, you will see that the lymph nodes are calcified. Can you see here? Very clearly. So this is another diagnostic feature of tuberculosis. Histopathologically, because we have already studied in general pathology, I'm going to go through it very quickly. So you know that a granulomatous inflammation is basically composed of focal zones of macrophages. These are all macrophages, okay? And there is a border of fibroblasts, and surrounding that there are several lymphocytes. So these blue dots are all lymphocytes. Fibroblasts, I don't know if you can appreciate, they should be spindle shaped with the nuclei, if you remember the structure. So all these cells are macrophages. So macrophages, after a period of time, they become a little bit enlarged and they're called as epithelioid cells. And these epithelioid cells eventually fuse together to form the most characteristic feature, that is the multinucleated giant cells. And in case of tuberculosis, these multinuclei are arranged in the form of a horseshoe, as you can see here, and in that scenario it is called as Langerhans giant cell. After this, please go and check out the video which I have uploaded, which will give you much better understanding of the histopathology of tuberculosis. So as the granulomas will become bigger, basically aging means it becomes bigger and bigger, central necrosis occurs, and that is called as caseation necrosis. And because when you see the specimen in gross, it looks like cheese, and that's why it is called as caseation necrosis. And there are special stains which are required to demonstrate this bacteria through the microbiological culture or staining, and that is the Ziehl-Neelsen stain. This is very important for the diagnosis of the disease. And you can see here that mycobacterium are all stained red. They are bacilli, correct? So you can very clearly see that they are chains of bacilli, and they are stained in red color against a blue background. So this is diagnostic of tuberculosis. Again, you can see here red bacilli against the blue background.